Is it clear in the presentation mode?
Yes, we can see your screen. We can see your screen.
Okay, perfect. Thank you so much. Thank you so much, Mohammed or Misenya, for that kind introduction. I really appreciate that. And so, as I've been introduced, I'm Jimmy Ngewate, and coming from the Institute in Kenya. We also focus on antimicrobial resistance and infectious diseases, particularly in Kenya and even some other countries across Africa. So we've done some work some times back in other countries outside Kenya, including even Nigeria. And I think that's where the club, the UDOIAS club, came from. So initially, we were known as Students Against Superbugs Africa, and before we transition to CE Institute. Today, I'm very pleased to join you in this interesting webinar on introduction to antimicrobial resistance, especially using a multidisciplinary approach and to address AMR, and at the same time highlighting the role of the young people in AMR mitigation. This is what we'll be talking in the next few minutes. So please, I hope you can see my screen. I hope my slides are moving on your end. Please confirm that sometimes it has a challenge. Can you see the second screen of the contents?
Yes, we can.
Perfect. Thank you so much. So we'll be briefly touching based on definition of AMR, the brief history of antibiotics and the emergence of AMR, development of AMR, drivers of AMR, the burden of AMR globally and also in Africa.
There's no hearing, Mr. Jimmy.
Sorry, what about now?
If you're having issues with hearing in, probably you should leave the meeting and join back. It's very loud and clear at this end.
So the rest of the team can hear me, please, because probably maybe.
Yes, you are audible, sir.
Okay, great. Yeah, thank you so much. And lastly, we'll also be looking at the roles of the young people in AMR mitigation. I believe that we have some background on antimicrobial resistance, and but if not, I will try to talk at a very introductory or basic level on this discussion today. I understand maybe even some of you might come from probably non-medical or non-health science programs. So I'll try to explain this in a very basic level. And antimicrobial resistance, known as AMR, is a phenomenon where microorganisms become resistant to antimicrobial drugs. So the medicines that are used to treat the various microbes, including bacteria, viruses, fungi, and parasites, become less effective because of development of resistance from these pathogens. And it makes infections difficult to be treated. And of course, because once a microbe resists any type of medication, any specific medication that usually used to treat it, no other currently a possible alternative option could be used to treat the same pathogen. So it becomes really difficult to control and treat that pathogen. And at the same time, it raises the cost of treatment because alternative options have to be sought. The treatment time or hospital stays will be lengthened in a hospital, of course, because of the persistence of the infections. So, for example, if the treatment time is supposed to be around a week or a month for a particular infection, but because of the resistance, it can go beyond that, maybe even 2 months or even several months to a year. And that makes it costly, especially on the patient side, at the same time on the hospital side. And ultimately to the whole country, and which is reflected even on the economic burden of AMR at a national level. One thing to highlight is that AMR is a natural phenomenon, so it occurs naturally within the microbes themselves. So it does not, it's not triggered, if I can say that, but this is something that we should know, because probably, it may make a lot of difference in raising AMR understanding and awareness that these microbes usually mutate at the natural state. So that's something that we need to know, and possibly it's really, really difficult to stop the mutation. I think the only thing that can be done is to slow down, or to reduce the rate of mutation of these microbes, specifically by reducing those chemical exposure to chemicals and even the medications at concentrations that can trigger the acceleration of AMR. Because here we can say that generally the human actions or anthropogenic factors are the main factors that are attributed to development of AMR, though it occurs naturally. We want to look at the brief history of antibiotics and the emergence of antimicrobial resistance. And probably maybe some of us have already heard before on the history of the wonder drug, or the breakthrough drug penicillin, which was discovered by Alexander Fleming in 1928. And this really saved a lot of lives during that time and even up to the current period. This was a breakthrough in medicine, and opened up the research and discovery of several other antimicrobial agents, including antibiotics, more antibacterials or antibiotics, antifungals, antivirals, and antiparasitics. And this also took several years for other antimicrobials to be developed since 1928. And at the same time, this improved the outcomes of patients, and even improved the quality of life all over the globe. But over time, it was witnessed, the reduction of antimicrobial or microbial infections was greatly witnessed. Because of course, due to development of these therapeutic medicines or anti-infectives of all types, which were able to treat and clear infections of any time within a very short time. That time, I think, maybe say the rate of AMR was quite low. Though it started immediately after the discovery of penicillin. That's another important thing also to mention. But at the rate at which AMR was developing or occurring at that time was quite low compared at the current state that we are. And we can say that even the burden of infectious diseases was a bit low, relatively low, compared to where we are at the moment. However, due to misuse of these antimicrobial agents and at the same time decline in antimicrobial research and development, AMR continued to grow and develop. And this became a very big problem because even looking at the development pipeline of antimicrobials, it declined quite because from the pharmaceutical point of view, we can attribute that to high cost involved in development of these medicines with a low profit turnover. So that's one of the things or factors that contributed to decline of antimicrobial research and development from the pharmaceutical companies or from the manufacturing point of view. But at the same time, the existing antimicrobials continue to be misused, whether in human health and agriculture, whether in animal health or crop production. The misuse of antimicrobials never stopped. And these two factors, maybe you can say that one of the factors that also contributed to high rate of development of AMR. And unfortunately, these medications, very important medications, reduce their effectiveness. And now we might be entering or proceeding or even going to the pre-antibiotic era. That's quite possible if this cannot be reversed, if the situation cannot be reversed. We might go back to where we were several centuries ago. This is quite unfortunate, and I think that's why AMR needs a lot of attention at the moment at every level, starting from awareness creation up to policy development and enforcement of actions, and also development of therapeutic medicines to curb the rising burden of AMR. How AMR develops and spread. I've already mentioned that microorganisms mutate naturally. So they change their system in a way that no medications, or let me say those medications that are used to treat them, will no longer be able to attack them and kill them within their system. So either changing the form in which that drug is metabolized within the pathogen itself, or developing maybe, for example, even the efflux enzymes, which can throw out the medication from the pathogen system. And that's a big, big problem now, contributing to the development of AMR. And this is accelerated by human actions, especially the misuse of antibiotics, be it overdose or using antibiotics for treatment of fungal infections or even viral infections. That's might be generally improper use of the antimicrobials, even in animal health, because I think at the moment there is also a high rate of misuse of antimicrobial drugs in promoting growth in livestock, and at the same time in management of pests in agricultural or crop farms. That's quite unfortunate, because this is one of the factors contributing to development of AMR from the environment. And when the pathogens, especially from the environment, come across some of these antibiotics or antimicrobials at very low concentration that is not able to kill them, and that's how the pathogen themselves start developing resistance. Another thing to mention is that resistance microbes spread within households, within communities, hospitals, and even across borders or beyond borders, from the national level up to the global level. And of course, probably this is something that has just started from a simple infection from an individual, which was initially triggered or caused by the misuse of these important medications called antimicrobials. And what do we expect if that happens? Of course, there will be outbreak of infectious disease catastrophes. For example, the pandemics, epidemics, and endemics, and other kind of public health security threats. This is quite serious, because I think even looking at the recent outbreaks, there's quite a number of strains that could not be treated by the existing medications, whether they are vaccines or drugs. And that raises a lot of fear, especially in emerging infectious disease outbreaks, especially due to mutation. And due to that emerging and re-emerging or re-emergence of infectious diseases. We want now to look at the drivers and some of the things that contribute to the development of AMR. And one is poor sanitation and infection prevention practices, especially in our homes. If we don't keep high standards or appropriate or maybe even basic hygienic standards, ensuring that where we live, how we eat, where we stay, and the environment around us is clean. That's one of the factors that contribute to AMR, because if you give pathogen a room to thrive, then of course there would be a need for use of antimicrobial drugs, which of course also facilitate the development of AMR, and it will be difficult to treat the pathogen once an outbreak occurs or any infection happens. Also, over prescription of antibiotics is one of the serious issues, let me say. For example, even in low and middle income countries, though it happens everywhere, but I think it's a very big problem that is, we can say, attributable to the development of AMR. And that's why it also is important to create awareness creation, especially among the young people, the medical professionals at any level, whether nurses, pharmacists, or medical scientists, or the medics, physicians themselves, whether professionals or students, because they play a key role in preventing AMR. Probably not quite a number of people understand these concepts, but for those especially who are hold the responsibility of taking care of the health of human beings, I think they should be at the forefront of preventing AMR and any other health problem from occurring. The issue of self-medication and complete treatment is another important thing to mention. And I think as a young people or the youth, this is where a lot of efforts required, especially creating awareness among the general public on the dangers of self-medication, especially on antimicrobials or in treatment of infectious diseases. Yeah, it's important to educate those really need this kind of information, that before you go for any medications or before you use any medications, it's important to seek a proper medical healthcare and consultations, having gone through the proper laboratory tests or analysis to really identify the specific infection that the patient is suffering from before prescribing any infection or any medication. Misuse of antibiotics in agriculture, I've mentioned that. Yeah, a lot of this is happening, especially in poultry, in aquaculture, and even in livestock production. I think this is a big problem all over the world, not only in Africa, though the burden probably might be high in Africa because of other complex factors, but it's a very serious problem which I think we need to address, because as much as we are after profits in the agricultural side, it's also important we need to look at the consequences that this might have on the general health of humans and even the animals themselves. Looking at the global burden of AMR, recent statistics that was done by the Institute of Human Health Metrics, IHME, about 21,000 or million, not thousand, people who died globally in 2021 had sepsis as an immediate cause of death. And we know sepsis is a problem for those who do not know, or maybe suffering from many infections at the same time. Yeah, let me put that at a very basic level. And probably you might have 2 different types of bacterial infections, and maybe even both of them have or the pathogens are resistant to their medications or antibiotics. This become a very big problem in treating these infections. Also, about 4 million people who died in 2021 suffered from drug-resistant infection, such as the lower respiratory, bloodstream, and intra-abdominal infections. Lower respiratory tract infections, I think, and bloodstream infections, which we can say sepsis. It's one of the other common diseases or infections that has been highly, where AMR has been highly witnessed, especially in Africa where the burden is high. And looking at where we are, talking of millions of people who died from this, I think it's enough to give us a lot of worries of the burden of AMR. That's where we are here talking today about the burden of AMR and how or what we can do as youth to mitigate AMR. Also, in 2021 still, about 1 million people who died in AMR were directly caused by AMR, or those infections that were attributable to AMR were due to the direct cause of antimicrobial resistance. So this is enough to tell us that this is not just a story. It's not just a statistic. AMR is a big problem, but I think probably we have some information already for us, maybe, and even those who are in the healthcare space, for example. So I think it's a big role now to create this awareness with the general public, using these real statistics and even using case studies which have already been witnessed and published in respective countries, really to spread awareness, whether using media or any other form of awareness. Yeah, to see that those who do not understand AMR at least have some basic understanding of this and the threat that we are witnessing or experiencing at the moment, yeah, from this big health threat. Also, about 9 people who are expected to die from AMR between 2025 and 2050. This is a projection still from IHME statistics, which was done sometimes, I think, in 2019 and 2021. So this is a really serious threat to human life and animal life as well. And I think if AMR is not addressed, but I believe if we put the necessary efforts and actions from all levels, we can try at least to minimize this. Otherwise, this is the looming threat that we will experience from antimicrobial resistance by the year 2050. But also to note that this is just a statistical projection and an approximation. This might even be worse than that. Yeah, this is just something that should be worry us more than anything else. And I think from a lot of data also published before, we can also say that or see that AMR is currently causing quite a number of deaths compared to other health problems, even cancer and other non-communicable diseases. Looking at the low and middle income countries, especially the sub-Saharan Africa, which is highly hit by AMR, as we can see on this map on the right, indicated by the red color. And though the burden of AMR is quite high across the globe, but looking at the current figure that we have, I think this is a huge or a serious problem in sub-Saharan Africa. Yeah, due to different or very many other factors. I've tried to mention a few of them, though not only this. For example, limited diagnostics and surveillance capacities, quite low in Africa. Maybe some of the healthcare facilities are not able to accurately detect or even test and detect whether they are bacterial, fungal, or viral infections. And this contributes to misdiagnosis and also the misuse of the drugs consequently. Also, the issue of infection prevention control, probably still because of lack of enough resources for IPCs, still big a challenge in low and middle income countries. Yeah, sometimes, not even sometimes, I think we can say that if we are able to prevent infections from occurring, then we should not be talking about AMR today. Yeah, that's what I really believe. But we're still talking about prevention of basic infections. Yeah, there's no day and time that we're going to avoid AMR from occurring. And I think when we start talking about prevention of AMR, we should start off how we are going to prevent this basic or simple infection from occurring at an individual level before even spreading to the community and across the globe. Socio-economic challenges, especially in low and middle income countries, of course, is some of or one of the serious or critical factor contributing to development of AMR. For example, if you have today, if you experience any infection and you're supposed to go through all possible laboratory analysis for the doctor to really determine the specific type of infection you're suffering from. But you're not able to afford, or you cannot afford the test to undergo all those tests, then I think this will undermine effective treatment. And this is another thing that need to be looked into quite seriously, because probably maybe by providing some incentives to companies producing antimicrobial drugs to see how we can reduce the cost of antimicrobials in general, at least to ensure that, or even diagnostic tests, to ensure that even those at a very low, or those who cannot afford, will be able to afford. So anyone who want to access any laboratory test should be able to access at least at a relatively low price or cost. And by doing that, I think we will be able to address the big problem contributing to development of AMR, especially in low and middle income countries. So we want to shift a bit to look at the broader AMR mitigation approaches, and I'll start by looking at the multidisciplinary approaches. And this essentially entails combining all disciplines or sectors and bringing them together to address this common problem of AMR affecting everyone, because AMR is not just a medical or a health problem. It cuts across all sectors. That means we need collaboration, coordination, and also mobilization from all sectors. Of course, medics and pharmacists, whether you are in human health or animal health, I think these are the frontline soldiers in mitigating AMR. But at the same time, other key professionals like microbiologists, public health, and environmental scientists play a big role in contributing their knowledge and skills in looking at AMR from all perspectives and dimensions. Other key areas include social science. For example, if one today to create AMR awareness in a specific setting, in a very rural setup, for example, in Nigeria, we need to look at how we're going to reach these people, how we're going to mobilize these people, what language these people understand, what are their cultural and social practices in their common life, and how can we integrate AMR prevention practices, or let me say, for example, AMR stewardship activities into their normal work or activities. So looking at the social science, how the behavior of these people also could influence the development of AMR, and how can we also learn from it, leverage from that to create context-specific interventions that will potentially reduce the misuse of antimicrobials or antibiotics in this particular community. And at the same time, making sure that intervention that will be deployed to this community aimed at reducing infections will work and sustainably be implemented by that particular community without even involvement of engagement of external factors or external forces. So there's so many other factors that we can look at through social science, which I think is quite important because, for example, if a country put up a lot of efforts, or even maybe, for example, the manufacturing side in manufacturing medicines, but the target, but for example, the community continue misusing these medicines. So I think there would be no point of even manufacturing these medicines. And that's why it's important. We need to also leverage on social science knowledge, looking at all dimensions in social science and behavioral science to address AMR at especially the community level, and how that can be connected to the healthcare facilities, primary healthcare centers up to the national level and even beyond, and also sharing all that data concerning any potential risk or factors contributing to development of AMR from a social science perspective. Political science and law, this is a bit unique, but at the same time, it's good that we engage political leaders and the policymakers in one, formulation of the policies aimed at addressing AMR, and even enforcement of the same policies. Because it's one thing to generate data to inform policies, it's another to formulate those policies, and another one to even enforce the policies themselves. So this is something that's important. AMR, it's no longer something to be ignored. I think should be talked about even at a political space, and engaging lawyers, even bringing in this into the policy making level, or even the chambers of lawmaking houses in our respective countries, to make sure that we can address AMR from all ways, especially even encouraging our political leaders also even to allocate resources, make sure that we are able to implement some of these actions to address AMR. Want to move on to another aspect of One Health. And when we talk about One Health, it's the integrated sphere of human health, animal health, and environmental health, and how these work together to make sure that we're able to address AMR from all these dimensions, or from these three important spheres, which are critical in AMR prevention. So, for example, in human health, or animal health, sorry, how can we prevent spillover of infectious agents from animal to human beings? Yeah, I think those are the things that we also need to understand, even educating our communities on possible route of contracting these infectious agents from the animals and even the environment itself. And even when you talk about the environment, there are so many other things to look at, including even the built environment. How can we make sure that where we live, and for example, where we work, is built in such a way that we're able to clean it very well, and even prevent possible reservoir regions that can harbor potentially harmful microbes, which can spread easily and might cause havoc within that given setting. So I think it's quite important looking at a professional knowledge of animal health, human health, and environment health, and how we can mitigate or prevent AMR from all these important three spheres. Antimicrobial stewardship is quite important because of so many reasons. Because, for example, I think in our respective national action plans in many countries, which already have the national action plans, antimicrobial stewardship is one of the key pillar of the national action plans. And the reason is that AMR probably is not that really known at the moment, if I can say that. And there is very little understanding of AMR, especially among people outside the healthcare space and the general public. And that's why it's important that we create awareness of antimicrobial resistance and educating people on how to appropriately use the antimicrobial drugs for prevention of AMR. So the reason why we need to put a lot of efforts in creating awareness and even promoting antimicrobial stewardship is that, of course, making sure that those who do not know about AMR first get to know what AMR is, even before putting up any measure to prevent it. First, you need to know, because there is no way you can address a problem that you do not understand. But once you understand, you will be even in a position to develop your own interventions or even preventive measures without the influence of any other person, either within or from outside. And also, we need to teach also people on how to understand the basic infection prevention practices, especially within our homes, looking at the practical activities that we can, making sure that we are able to prevent the occurrence of the simple or basic infections from within where we live, and making sure that we maintain high levels of hygiene, which I think is the foundations of prevention of AMR. And also, it's important that we promote the responsible use of antimicrobials at every sector. I mentioned about the current growing trend of misuse of antimicrobials in agriculture. So it's important that we talk more of the dangers associated with that than even the intentions of the current use, because I think the reason why farmers currently use antimicrobials, especially in agriculture, is because of fattening animals, I think, to promote faster growth. So I think once they understand the dangers of antimicrobial misuse, especially for that particular purpose, we'll be able to address AMR together, and even prevent the spread of AMR from animal health to human health. And of course, by doing that, we'll be able to even prevent the occurrence of infections. And when they happen, at least we'll be able to treat them with the current existing medications. Yeah, we'll be able to preserve the effectiveness of the medicine that we have. Okay, great. So infection prevention and control against AMR, as I've mentioned, this is the foundation of prevention of AMR. And yeah, I think this is where all begins. Yeah, we need to start addressing, yeah, what can we do to prevent the occurrence of these infections. And by doing that, we will not be no need of talking about AMR again. But I think, yeah, because this is a natural phenomenon that might happen, not might happen, that happens, whether the influence of anthropogenic factors or not. But I think once we're able to control or prevent these infections and use antimicrobials effectively, yeah, we can really slow down the growth of or development of AMR. And the basic hand hygiene practices are important because it can help us to reduce hand-to-hand as well as surface-to-hand pathogen transmission. And in vaccination, whether in human health or animal health, this is important because we'll be able to prevent the occurrence of infections before they spread. And ensuring that the water that we use, especially at our homes, is clean, and also making sure that we live in at least hygienic environment, making sure that we have or maintain high levels of hygiene and sanitation. And this will help us to reduce the transmission or minimize the transmission and spread of resistant microbes, through water, food, and even the environment. Yeah, this is key, especially among the food vendors in our markets. If we'll be able to educate them on how they can make sure that they keep hygiene with their marketplaces, even when you as a consumer of the same products, you will be safe, from consuming any of these resistance microbes or any potentially pathogenic microbe, which might be encountered if we don't keep or clean our services, and thus at the same time the foods that we eat. Biosecurity measures that cannot go unmentioned, especially in animal health. The hatcheries, making sure that the high levels of hygiene are maintained always. And by doing that, we will not only prevent infections within the animal themselves, but also the transmission or the spilloff of some of these potentially harmful pathogens to human beings. Going on and looking at why we are talking about infection prevention and control is I've mentioned that without this, I think we'll keep on thinking about frequent infections at every level, every time. But I think if we'll be able to minimize this, it will go a long way in preventing the occurrence of infections and ultimately slowing down the growth of AMR. And looking at this graph on the left, and still this is a statistic that was done sometimes back by still IHME, is that out of 92 million deaths that could be averted through better healthcare for severe infections and access to antibiotics, many of them would be in sub-Saharan Africa and South Asia. And this underscores existing inequalities across these different regions because of, for example, in Africa, of course, access to healthcare services is quite different from maybe any other part in the world. For example, Central Europe, Eastern Europe, and Central Asia, or probably in other high-income countries. Yeah, all these disparities is what bring all these differences in the burden of AMR. So looking at this graph, sub-Saharan Africa will potentially suffer from about 25 million deaths. This is quite serious. And this tells us that we are quite at danger time. I can say that, especially due to AMR and other potential avenues that could cause these public health catastrophes. And I think looking at South Asia and Sub-Saharan Africa, that's where a lot of attention is needed, even in addressing AMR. Because I think otherwise, if these actions are not taken, especially in addressing AMR, we'll experience all these a number of deaths. So I think this is enough for us to see the burden of AMR, not only in Africa alone, but globally. But how that will even reflect to our current life and even the quality of life that we live, quite concerning, especially in Africa, where we are. And I think there are quite a number of factors which I can say could be attributable to this, and even the kind of medicine that the quality of the medicines that we access, probably in low and middle income countries, is another big issue, which I think put these countries, sorry, at a serious threat to infectious disease outbreaks, especially the resistance or antimicrobial resistance infections. So I will share this later, then, but I've already shared. You can go have a look at this, read the statistics and the data. But this is a bit serious issue that we also need to put a lot of attention. And wherever we go, whether in our communities, engaging our peers, yeah, let's just try to talk about this burden of AMR at every level. And I think those very little action that we take at an individual level, yeah, will go a long way in preventing or even reducing AMR. And that's how we also be able to avert this burden of expected or projected burden in our own countries. Now looking at the important topic on the role of the young people in addressing AMR, yeah, this cannot, I think, looking at all stakeholders in addressing AMR, one of the population that somehow have been overlooked by the young people, which I think should no longer be the case, as they play a very important role in ensuring sustainability of AMR stewardship programs, and even in through any other or so many other ways to curb AMR. For example, one of the ways that the youth can engage in is through strengthening community engagement and advocacy on AMR, infection prevention and control, and so many other ways. Yeah, educating the communities on how we can avert this problem of AMR. Even how we handle ourselves, how we live, our behavior in general influences our peers. For example, looking at how, for example, a medical professional behaves, or a medical student behaves, and probably that might inspire someone else in another field who probably behaves in a different way and put them at risk of these infections. So even on how we do what we do and all that and how we interact with each other is quite important as the young people. I think this is the population that co-interact a lot in life or through any other physical and through any other activity, especially in working places, institutions, and almost everywhere. So I think this is quite important to also mention. And also social media or a digital space is quite an important space that we can use or leverage to create campaigns of knowledge on AMR. I think the young people, the youth, is the leading the population online or on social media. So I think this is where we can also take these campaigns on AMR awareness to educate our colleagues and even the general public on the dangers or how we can promote AMR understanding. The youth can also engage in educational content still online through all forms of media, and at the same time conduct the basic research and even development of interventions against AMR. Yeah, whether through collaborations or themselves, especially even engaging in basic and simple research that can inform important policies or even interventions to curb AMR. And through that, they can also contribute to even policy formulation and focusing. I think through the basic research that we do and that data that we inform through that, yeah, will also be useful in formulating some of these policies that will be important in addressing AMR. Because I think looking at how sustainability of AMR can be enhanced is, I think we need to look at how we develop policies based on data that we generate. So I think that's calls on the importance of research and also data generation to inform some of these policies. Otherwise, we may not be able to achieve accurately on some of these interventions and even measures to address AMR. And these are the areas that the young people can also take part in, and they have the potential, I believe. And some of the opportunities that the young people can also engage in to promote AMR understanding at any level is, for example, through career development opportunities. So wherever you go with through research and educational fellowship programs, I think this is another space that you can also learn more and also at the same time create AMR at that level. Internships and apprenticeships, summer training programs, and short AMR courses. These are the opportunities that we can also use to grow our knowledge and expertise and competence in AMR, infection prevention and control, and any other field related to antimicrobial resistance mitigation. So, because if we have a career in AMR, if you as a student have a career in AMR or infectious disease space, this is, I think, would be one of the important areas that at the moment you can engage in, whether alongside your studies or even after your studies, to build your knowledge and grow professionally, and even engage with experience and professional experts in this field, learning more on what is being done at the moment and what is coming up. There are a lot of emerging technologies and advancements in infectious diseases and AMR, especially through integration or incorporation of tech, or through development of tech and other important technologies that are coming up. So I would really encourage you, to take some of these steps, to enhance your knowledge and competence in addressing AMR. And also research is another important area that you as a young person or youth, can engage in research, especially starting from even the basic behavioral and social science research, which doesn't need a lot of investment compared to laboratory research. I think if we come together as you as students, for example, you can try to do something that it can inform important policies and even intervention to address AMR within your respective communities and even among students themselves or your students yourselves. At the same time, it's important that we also engage in basic research. I really encourage that, especially as a young person, also to grow professionally and at the same time generate that useful data which would be required to support this intervention to address AMR. And currently, because of a lot of advancements in every space, AMR has been integrated with quite a number of fields, including data science and tech. And I think quite a lot of interest is growing here in how we can integrate these emerging technologies with AMR. Also, the issue of geospatial information science, or GIS, and how that can be used to map hotspots in AMR, looking at regions, or to map regions that has, for example, a high burden of outbreaks. At the same time, looking at where inequities or inequalities is high in terms of access to healthcare services, and how that will ultimately inform the burden of AMR or infectious diseases in that particular region. And by looking at all that aspects of spatial epidemiology and mapping, we can model or even develop AI-based models, or even AI-guided technologies that can help us to project the burden of AMR before it happens. At the same time, inform appropriate actions to curb that before it happens. And also, all that will also inform policies. And through that, I think it's important for us, even as youth, to engage in policy research. Which types of policies are required to address AMR at this particular stage and at this particular sector, and what these particular policies can inform in terms of AMR, all that, and even in terms of implementation of these policies, who is needed to implement these policies, and how are they required to implement those policies, and what do they require to implement those policies, and how are the social life of these people will influence the implementation of these policies in their settings. There's so many other aspects that we can look at when looking at the integration of AMR research and policy research with the goal of addressing AMR. These, I think, are one of the important areas that probably somehow the youth is at the moment left out. But I think I would really encourage you to explore on this. And I think by the time you progress in your career, I think you will have gained a lot of knowledge in one or two of these areas that you've chosen. And there are so many opportunities that we can engage in, as I've mentioned, but at the same time, the important thing is also, as a young person or the youth, is to position yourself to tap on these opportunities. And one of the ways that we can do that is that, as the youth, especially maybe, for example, the students, we can engage in different or several activities in infectious disease. For example, even participating in events themselves, attending conferences, and listening to what professionals are discussing and saying, and also contribute to those discussions. At the same time, I know that probably, we have talented and skilled youth, or even students among us yourself. So how can you bring in your skills to promote AMR education, for example, in supporting, in designing communication materials such as webinar flyers, even setting up websites? One, you will also improve your skills and expertise, grow professionally in that line, but at the same time, helping the space of AMR and continue disseminating this information to those who really need. Or maybe even you can support organizing some of these conferences. And at the same time, you're an expert, because I know some of us are quite good in some areas, especially related to AMR or any other technical field. You can even facilitate some of these workshops and master classes, to educate the rest, and even engaging in these important discussions on to address AMR at any levels. Also, as youth, you can engage in AMR professional development programs and activities. For example, even some basic research. For example, the reviews, which are cost-effective. Systematic review, scoping review. Those are quite useful, and in informing some of informations or interventions in addressing AMR. Yeah, and I think also by collaborating with professionals, we'll be able to see how we can do that in a way that we can tailor our research to the needs of our communities, to the needs of our countries, to the needs of that particular setting that you are. Because I think one of the things to do, we need to do is that try to develop intervention that will be applicable to your target setting. Otherwise, probably, yeah, that would be a challenge even when it comes to implementation. So I think these are some of the areas that we, as young people, can engage in, and even through volunteerships and internships. As a young person, the most important thing is to learn. Yeah, even don't even have to mind a lot about all this. I'm not earning anything. What am I gaining from here? I think the most important thing is a young person or a student even, yeah, is first learn, yeah, gain those skills and competency, that's knowledge, which will even help you to gain more knowledge in that area, especially in AMR. Yeah, and also even you'll be able to have even a higher bargaining power, yeah, when it comes to this employment opportunities, especially in AMR. Yeah. So when you have all these unique skills, trying to bring them together on how, yeah, we can also contribute to AMR mitigation in any of the ways, yeah, possible, especially looking at the unique skills that probably maybe most of the people do not have. And as I conclude, some of the key takeaways that we can mention from this discussion is that we need coordinated efforts to mitigate AMR. We've looked at the One Health approach, and even bringing professionals from different fields, that is a multi-professional approach. So I think without coordination of all these sectors and even these professionals, we may not be able to achieve our goals in addressing AMR. Also, the youth engagement is crucial for sustainable AMR prevention, especially in AMR stewardship. Not AMR stewardship, but antimicrobial stewardship. And lastly, your today's smaller actionable efforts are tomorrow's superbugs defenses. Yeah, whatever you're doing today, that's small action you're taking to address AMR is our tomorrow defense against the emerging and re-emerging superbugs. That's the end of my presentation, and thank you so much for listening to me. And back to you, Hamad.
So thank you very much, Mr. Jimmy, for this insightful and loaded session. Personally, my jotters are already filled with valuable points and lessons from this webinar, and I'm sure I can speak for many others on this call. And I say that we've learned a great deal on how we youths can contribute meaningfully to the fight against antimicrobial resistance. And also from today's session, we have heard that responsible antibiotic use, good hygiene, awareness, and continuous advocacy also play a very important role in combating in fight against antimicrobial resistance. So we'll now move on to the question and answer segment. So if you have any questions, you could simply send them through the chat box, or you can just raise your hands and signify so that you'll be given the opportunity to speak.
All right. Thank you very much, Mr. Jimmy. As Muhammad said, the session was a very insightful one, and we'll all have learned one or two from the session. So while we await you all showing interest in asking questions. I'd like to inform you that you all can just take a minute of your time to check the info messages, the info chat box for the attendance for today's session. Kindly note that your attendance will be considered before you will be issued certificate of participation for this bootcamp. Check the info message. That's the only place you'll be sharing the link to the attendance. It won't be shared to the WhatsApp group. So kindly ensure you fill in your attendance before you leave this call. Thank you very much. So as Muhammad said, if you have any questions, you can drop them in the in-call messages or probably raise your hand.
Okay, I think I can see a question on the chat from Bello. How does environment play a role in AMR? Yeah, that's very important, and environment is quite important sector to talk about when we are discussing about AMR. Because let's begin from the point of, for example, waste disposal or even antimicrobial disposal, especially maybe from hospitals or even the pharmaceutical companies, where we dispose our antimicrobials. For example, even in our sewage sites, if today you take a leftover antibiotic to the disposal site on the ground, and probably maybe, of course, chances are that it will come in contact with any kind of a pathogen, especially the one that was targeted by that antibiotic or maybe antimicrobial in general. And of course, the concentration of some of these drugs at disposal sites, let me use this disposal sites or waste sites as an example, is the concentration at which those drugs is in relative to treatment of this or the dosage required to treat this antimicrobials. The microbials is quite low. So what happens is that the microbes will start developing resistance. And at the same time, because combining that with the aspect of selection pressure, and if you expose a microbe to an environment where it can get access to those antimicrobials or the antibiotics, for example, it will start developing mechanisms or mutations within their system, to prevent that drug from killing that particular pathogen. So that's one aspect, especially in how we dispose these antibiotics recklessly or unnecessarily on the environment. So I think another important thing, that we need to consider in addressing AMR is that how we dispose these medications. We need to do that appropriately. Otherwise, I think we're really contributing to AMR. At the same time, environment, because I think when we say environment, it's a bit broad, is that even exposure to some of these pathogens, it's important that we keep clean our surroundings, especially on where we live. Otherwise, for example, that will increase chances of us getting in contact with some of these infectious pathogens. So if we don't keep clean our environment, we are creating room for AMR, because I've mentioned earlier on, I think the starting point of us addressing AMR is to prevent infections from occurring. So that's what I can say. And if we don't clean the environment again, we are creating a room for that pathogen to spill over from their natural habitats into human beings. Yeah, for example, let me talk of the vectors that transmit some of the infections, like, for example, malaria. Yeah, I think if we don't clean services, especially that harbor some of these vectors, we are putting ourselves at risk of getting infections and ultimately contributing to development AMR, because if we don't at the same time use our medications in a proper way to treat these infections, that will ultimately contribute to the AMR. Yeah, I hope that answers your question below.
Yes, sir. Thank you very much.
Right. Thank you very much, Mr. Jimmy, for answering the question, I guess, in the best way possible. Thank you very much. So if you have any other question, you can still like put your hands up or drop them in the chat box while I read them out for Mr. Jimmy to answer. Once again, kindly check the income message for your attendance. It is very, very important to mark your attendance for today's session, as this will be considered before you be issued certificate of participation for this boot camp. So while I await anyone with question, I would like us to remember that this boot camp is a 10 weeks program, and it is very important for us to stay consistent to the very end of the boot camp. So the boot camp is aimed at equipping us all with practical and foundational knowledge in antimicrobial resistance and One Health. And throughout the program, not just this week only, in the next 10 weeks, we'll be exploring important areas such as AMR foundations and One Health, which Mr. Jimmy has introduced to us today. We'll also be looking at AMR surveillance and data for beginners, antibiotics and misuse in real-life settings, AMR communication and advocacy, infection prevention and control, as well as design thinking and policy framing. So Mr. Jimmy has walked us through introduction to AMR and One Health, and I'm very sure every one of us have learned a whole lot of things, because personally, I've learned a lot from today's session. So today's session is a very, very important conversation, because we all have critical roles to play in awareness creation, in advocating for the right use of antibiotics, and in engaging our communities, and as well as being part of policy conversations around antimicrobial resistance. And so as we continue this boot camp, as we concluded the first week, so I will encourage every one of us to remain consistent with attendance, to remain attentive, to participate actively, ask questions, and ask questions, let the sessions be interactive, and make the most of this learning opportunity. We believe the knowledge and networks built during this boot camp will contribute meaningfully to us being public health advocates and action takers in our various community. So if you have questions, the floor is still open for every one of us. If you have any area that is not clear to you, you understand that most of us here are just putting our feet into the world of antimicrobial resistance stewardship. So any question whatsoever is welcome, and Mr. Jimmy is here with us to give answers to them. Okay. All right. Mr. Jimmy, there's a question here for you, sir. Shitu Yaya asks that in a situation where an individual becomes resistant to some drugs, is there any way to solve the problem, sir?
Okay, great. That's a very nice question. And I will respond it this way, that so in treatment of infectious diseases, there are different classes of antimicrobials or different classes of anti-infectives, depending on the disease that you're suffering from, or depending on the infection that you're suffering from. And for example, if the first first line of because they're usually the first line, second line, and even up to the third line of medications. And if you're the first lines of medication, for example, if some of the antibiotics in first lines become resistant to a certain pathogen, that means the doctor has to choose the second option, which now a different class of the medications, and keep on changing the classes of these medications, but should not be the best way to go, because there are reasons, why these antimicrobials are also in different classes, especially those suffering from mild infections and severe or highly severe infections, are usually prescribed these medications, in that order. But again, to add on that, there are also emerging options on to treat infectious diseases. One is the use of bacteriophages or phages, and these are viruses that can be used to kill a bacterial infection. I mean, a bacteria that can, or a bacterium that can, no, sorry, a virus that can attack the bacterium and kill it, just like how antibiotics do. And this is still, so I think this has not yet been fully adopted, especially in low and middle income countries. A lot of research is still going on. Though in Kenya, some of these practices have been adopted, especially in animal health and poultry. There is one case of use of bacteriophages in poultry. So that's one success right at the moment. But I think in some other countries like the US, the use of bacteriophages have been quite explored. And also, I think another issue is regulation. And so, because I think maybe one of the challenges also limiting the use of macrophages, especially in most of the African countries, is we don't have policies to regulate or frameworks to regulate the development and use of bacteriophages in human health. So hopefully that is something that we will also fully adopt in Africa, but it's coming up. And I think in very many other countries outside Africa, which I know, the US and Italy, I think to mention, and so many others, are at the moment using some of the veggies for treatment of resistance infectious diseases. There are some cases which even all classes of antibiotics have failed in a patient. I don't remember exactly in the country, and the only option that was available is a bacteriophage. And ultimately, and fortunately, the bacteriophage saved the life of the patient, and the infection was treated. So currently, that's an option that's being explored. And of course, there is vaccination, but that one has to happen before the infection. So I think what will be even more effective compared to the use of antibiotics, because the pathogens will not develop resistance to vaccines unless, of course, there is emergence of different strains, probably, and the previous vaccine may not target the new strain, but at least I think I can say the rate at which resistance to vaccines is happening is quite low compared to that resistance on antimicrobials. So those are the options, but hopefully maybe in future we will also have our own manufacturing site for phages in Africa. Thank you.
All right. Thank you very much, Mr. Jimmy, for the answer to that question. Really appreciate your time, and despite your schedules, really appreciate your presence in today's session. And I'm quite sure our members have really gained a lot from you, from the session today. So on this note, we'll be drawing the cocktail on today's session, and we'll be thanking you once again for taking out of your time to attend today's session and to participate this session for us. And to the members as well, like I said earlier, this is just week one of a 10 weeks bootcamp, and we expect every one of us to stay consistent and make the best use of the bootcamp. So till next week when we'll be meeting again, may we meet in peace and not in pieces. Thank you very much. Kindly check the in-call message for your attendance once again before leaving the call. The attendance link will not be shared in the WhatsApp group. Please ensure you mark your attendance before leaving the call.
So thank you once again. Just like TLC has said, thank you, Mr. Jimmy, for honoring our invitation, and to our participants and members. We hope that you leave this webinar better informed and inspired and motivated to take action. So for the person asking if the slides are going to be shared, yes, I'll be sharing the slides on the group. So lastly, I would like to take a group photo with Mr. Jimmy. So we can all turn on our cameras so we can capture our beautiful faces. So I think that's it. Thank you very much.
Okay, thank you. Thank you so much, Muhammad, and your team. I really love what your team is doing. Dias, I think it has been a long time engaging with you, and I'm very pleased and encouraged by the work that you're doing on AMR. And yeah, we're here to support you, and looking forward to see the great work that you'll be doing going forward. I think with all that, I do not have any other additional remark on my end, and I wish you all the best going forward in the webinar series educational program that you have. And you'll now please excuse me because I have another engagement after this. Yeah, then in case of any further question, please you can direct it to me, then I can be able to respond. Thank you so much, everyone, and bye.
So thank you very, very much, sir. We really appreciate your presence. So you can leave at your convenience. So thank you very, very much. So to our members, we have a very short assignment for you. We want you to share what you've learned from this webinar. A short message. It could be, you could post it on your social media accounts, maybe Twitter, X, Facebook, LinkedIn, Instagram. You could share it, and when you share it, you could send it link to the group so that we could engage. And most preferably, if you have a LinkedIn account, you could tag Mr. Jimmy on LinkedIn, you can tag myself or TSA, and just share what you've learned today. So thank you very much. We'll be ending this session now. So if you have any other questions and you want me to direct it to Mr. Jimmy, you can just send me a DM and I'll forward it to him via mail. Thank you very much for your time.